I think so.
You are now live.
Okay, thank you. All right, we'll call this meeting to order. Good afternoon, everybody. This is the Thursday, October 22nd, 2020 Board of Health meeting. I'd like to remind everybody that this meeting is being recorded by video and audio. And pursuant to Governor's March 12, 2020 order suspending certain provisions of the open meeting law, any Nantucket public body that holds a meeting will do so via Zoom video conferencing. The video conference will be shown on Nantucket's Government TV YouTube page. We are now using Zoom webinar for meetings, which allows the public to participate in the meeting as an attendee. Attendees must register to participate. The registration link is unique to the meeting. The registration link can be found in the description of the Nantucket Government TV YouTube live feed for the meeting. People registering to be an attendee must use their names. Otherwise, they will not be allowed to participate in discussion. Attendees will join in listening mode. They can click the raise hand button if they wish to speak. The chair will call on those who have raised their hands in order they were raised. If you don't have any audio capable device, the Q&A button can be used to type a question. The YouTube chat will no longer be enabled. Any questions that cannot be verbally asked must use the Q&A function. All questions should be directed through the chair. And for roll call purposes, as I see you for the attendance of the meeting, please announce that you are here. Meredith Lepre.
Here.
Melissa Murphy.
Here.
Jimmy Cooper. We also have Art Crowley from the Board of Health. Director Roberto Santa Maria.
Here.
And we also have an attendee, Dan Malloy. So.
Here.
Thanks, Dan. Any public comment? Anybody, you see any hands raised, Roberto?
I see Bill Greeter has his hand raised. I am not as a co-host, so NCTV, can you give Bill Greeter chat capability?
Okay, repeat that, Roberto. I couldn't hear you.
I'm not a co-host, so can you put Bill Greeter give him a talking?
Yeah, 1 second. I'm not seeing Bill on here.
He's a participant as an attendee.
Okay. So you want to make him a panelist?
No, just allow him to speak, please.
Okay, 1 second. Okay, it should be working now.
There you go, Bill. You're live now. Just unmute.
I think I have accomplished that. Thank you so much for giving me the opportunity during the public comment. Just wanted to take a minute to thank Art Crowley and Ann Barrett for listening to our concerns on the Board of Health local Reg 51 to get the latest reg put up on the website. I know you guys are all swamped with work, but it's much appreciated to get the information out there. And while folks may not like to hear the news, we think that it's best that they get the news, good or bad, as soon as possible, so that if it's good news, they can celebrate. But if it's bad news, they can plan on what they have to do to prepare to deal with whatever the new regs are. So I just wanted to thank those two and anybody else that helped out Roberto to get this particular reg squared away. The other thing is a question on a follow-up to a couple of weeks ago. The board was chatting about, and I don't know what the correct term is, but the time frame for hooking up to sewer in Nantucket as regards to IA systems installation and whatever. And so I still can't quite figure out, is that going to be part of 69? Is that going to be part of 51? And it's my understanding that it needs to be, the verbiage needs to be tweaked some more so that you can stick it into wherever it's appropriate. So thank you very much. And if you could just let us know on that follow-up question, that'd be terrific.
I don't know if I mean, I can't remember if that wordage is going to be, if it's part of 69 or it was in one of the sub-chapters of 51 with the exemption for, you would put the IA in the time frame that we were going to give of the 15 years that we voted for in the September meeting. Go ahead, Art.
So that policy was an IA policy created in 2015 by the board, and it's island-wide. So I believe all you did was amend that policy from 2015. The exact date I thought was October of 15. So you'd stay with the same policy, and you're going to, you know, correct or change the years and whatnot. So it wouldn't be part of 51, because I believe 51 is specific to Nantucket. So that's just my feeling. It would be, Roberto, it would just be a straight up policy and would continue with this, with the policy. But I'll defer to Roberto on that.
No, I believe Art's correct. We were going to do that policy island wide.
Yeah, how does like Bill or the general public find that policy?
Bill, I think you're still live if you want to.
That was going to be my question. So thank you, Steve, for asking it. So would I go on the Board of Health website and look for the IA policy?
We can get it posted on the regulations page, so you can have it there.
Okay, great. Thank you very much.
Yes, sir.
Okay, thanks, Bill. Any more comment, the hands raised that you see? All right,
I believe that's it.
start with your the director's report.
So real quick, so that we can move on to the last minute addition to the agenda for the emergency orders. Since the emergency order number 13 came in about a week ago now, we issued 11 citations, totaling about $7,500 so far. People have got the message. Those first few days, we issued a significant amount of tickets and got a lot of attention, and now we're seeing people really pay attention. So that's good. So we only had to issue 2 so far this week, and I'll be able to follow up next week on the enforcement report for the select board. But otherwise, we had 3 cases today. Both were isolated all 3 were isolated. 2 were associated with travel. One is related to a previous case, so that's all good news. And then that's really it. It's really been, at least in my little box here, it's been all COVID every day, all day. Art, Kathy, John, and Madison, our seasonal person, have all been out there getting things done. And now that we're finally getting into a relatively new normal, I'll be able to start crunching the numbers from our performance management system again and start getting that to you on a regular basis like we were before. Okay.
Questions for Roberta? Do you want to move right into 11 and reaffirming that?
Yes. So let me really quick pop open the emergency order. I'm going to share my screen real fast just so you can see it. This is the emergency order that we did to allow outdoor dining for restaurants. The select board already voted to move it back, to extend it to March. Right now it is set to expire on November 1st. So I would suggest that we vote to extend it also to our March Board of Health meeting, which would be, let me confirm that for you. March 18th. So if we can set it to expire on March 19th, so that if we had to extend it again, we would have time on that Board of Health meeting. And I would suggest we extend it to the March meeting.
Yeah, we accept, okay. Well, I had a motion to extend the outdoor dining
So moved.
Order 11 to March 18th, 2021. I get a second?
Second.
Okay, all in favor by roll call vote. Meredith Leffery,
Yes.
Melissa Murphy,
Aye.
Jim Cooper, yes. You're muted. Like, Steve Visco says aye, so that's a majority vote.
Okay.
We got you.
Go, Jimmy.
We got you now.
Okay,
Okay,
thanks.
so that passes. Extended to the 18th of 2021, March 18th.
Okay, thank you.
Okay, next we have review of the minutes from September 14th and 17th and October 5th and 6th. Any additions or corrections? Take a motion to accept the minutes.
So move.
Can I get a second?
Second.
Okay, all in favor by roll call vote. Melissa Murphy,
Aye.
Meredith Leffery,
Yes.
Jim Cooper,
Yes.
and Steve Visco says yes. Next is release of a loan for Slade, 12 Longwood Drive.
Same loan is the next three actually are just loans that have already completed what it is that they need to complete, and we're in order to remove it from the formal lien from the property, we need a vote from the board to release the loan.
Okay.
Do
Do you want to lump those together?
that would be great.
Okay.
Art has a comment.
I'm only, because Ann promised her I'd mention this, that the requirement is for every board member to sign this. And the board has to agree to let the chair sign it so that everybody doesn't have to come in here and sign these releases. So I don't know how you figure that out, but
If I made a motion to release the loans for Slade, 12 Longwood Drive, Madden Pearl, 19 Wallwinnet Road, and Jennison, 51 Tennessee Ave, with the addition of allowing the chair to sign on behalf of the board, would that be an appropriate motion?
Perfect.
So moved.
Second. A second.
Okay, all in favor by roll call vote. Jim Cooper,
Yes.
Melissa Murphy,
Aye.
Meredith Leffery,
Yes.
and Steve Visco says yes. Loan request, 19 Shimo Pond, septic to sewer.
Yes, so the same with the next three loans. We can probably lump them all together. Well, this one and the next one are septic to sewer. The next one, the one after that, is repair of a septic system with an IA. It's just the work that we've been requiring. They're trying to do what's right. We have no objections to any of the three.
Okay, I'll make a motion to approve three loan requests: Tilney, 19 Shimo Pond Road for septic to sewer, Conan, 2 Meadow Drive for septic to sewer, and Peterson, 321 Pulpus Road for repair to septic.
Second.
Okay, thanks. All in favor by roll call vote. Jim Cooper,
Yes.
Melissa Murphy,
Aye.
Meredith Leffery,
Yes.
and Steve Visco says yes. That brings us to variance request for 22 Boulevard.
Yes, so this is the variance request brought on by Dan Malloy. He's here for us today. It is to, I believe it's 14 bedrooms on the property. Right now, by right, they can do 12. With the conventional system, they're asking for the variance to get the 2 extra bedrooms. Dan, if you would like, you are a panelist, so if you would want to share your screen to show any plans or anything like that, you can. But if you want to take over, please go ahead.
If anybody wants to see the plan, I can certainly go through it. I know it's in the packet too, if anybody wants it. Just, do you want me to go through the plan in detail? I'm happy to do it if you want.
I'd like
No,
to
I
see
think
a
just,
little bit of it.
I'm sorry, Meredith.
I would just like to see a little of, I mean, 14 bedrooms seems like a lot, so.
Okay, let me see if I can share this across here. All right, does that plan come up on everybody's screen?
Yeah.
Yes.
Yes.
Okay. So it's 22 Boulevard, and we have a pretty large residential establishment going in. So we have a house here in the middle. It's under construction now. There's a shed over here. It's under construction. The pool here, a pool house, and a garage. So all of these facilities here are actively under construction now. They're proposing another barn back here, and then a second dwelling further back over here. The way this all is laid out to work is we actually have one big leaching area right here for the 14 bedrooms. But all of the tankage and treatment system, the septic tank units are broken into 2 different compartments. So you actually have 2 separate sets of tanks. You have a whole septic tank treatment system like you normally would have here that services this cluster of buildings under construction. And you have another septic tank system over here to service the back 2 buildings, which haven't been started yet. So it's effectively 2 systems sharing one big leaching area. So you have 2 septic tank units, each of them sized, I believe, for the 7 bedrooms. Everything else permit-wise is compliant. There's no other waivers, variance, nothing else requested. Does meet the criteria of other variances for a similar request that the board has granted in the past.
Okay, why don't we have like Art or maybe you, Dan, explain, because Meredith is pretty much all new to the septic stuff with the
Okay.
eyes and maybe explain the whole situation with the net benefit and
Okay, sure. So under the regulations, you're allowed basically by right to have 1 bedroom per 10,000 square feet of lot area with no advanced treatment at all, just a conventional septic system. The state has allowed, state of Massachusetts DEP allows additional bedrooms to be put on the property if an advanced treatment system is used, which is what we're proposing in this case. And what that allows is you to put additional bedrooms on a property because you're treating the waste. Essentially, the waste that comes out of this system is treated at a higher level than a conventional system would do otherwise. So even though the amount of flow you're approving is higher than would be there otherwise, the quality of the effluent is also better due to the treatment systems proposed. I may say that backwards. So the reason we're in front of the board for this is the property is located, it's on well water, and it's also located in the wellhead protection district that just skirts the property almost out to the frontage. So those are the reasons it's before the board.
right. So as you know, and to put it into simpler terms, you could normally have, say, 10 bedrooms, conventional septic. With the IA, you're really having the loading of a 7-bedroom system, which is a net benefit of three bedrooms, which is better for the environment. So we've granted these in the past, many in Nantucket before the rules have changed, many in the Hummock Pond watershed. So I mean, that's why
I can add to that quickly. You did approve one right next door, just on this property to the right. You're looking at over here, the same variance is granted on this property.
Right. Anybody have any questions for Dan? I can only see a few. If you could drop that now, Dan, I guess that's good. Everybody all set? I get a motion then to approve or deny the variance.
I'll make a motion to approve.
Second.
Okay, all in favor to approve the motion by roll call vote? Melissa Murphy,
Aye.
Jim Cooper,
Yes.
Meredith Lepre,
Yes.
and Steve Visco says yes.
Thank you.
Yeah. Okay, make school nurses agents of the board for COVID-19 case investigations.
Yes. So what we're running into is the agents of the Board of Health are allowed to share information among each other with regard to protected health information. As of right now, because the nurses are not agents of the Board of Health, if they were to run into a COVID situation at the schools, they can't necessarily communicate that to us, and we can't necessarily communicate that back if we were to find out some information too. So by making them agents, we can do the joint case investigation, everything from exposures and contact tracing at the schools, and even freely interacting with each other for protected health information. So by making them agents, it makes our whole COVID response that much easier at the schools. This is just something we're looking for, and I know Meredith is one of the nurses at the schools as well. If you would like to chime in on this, though I've been in contact with Meredith, Sarah Brooks, and Beth Hallett. Sarah Brooks is coordinating all the nurses as well in the COVID response. She's one of the nurses at the schools as well. And Beth, of course, is the superintendent. We're all in agreement that this would be effective and helpful. Meredith, would you like to add anything?
Yeah, I just think this would make our job easier. We have, like I have for every single teacher in the elementary school, a seating chart. So if we found out that a student in the school was positive, we would know exactly who the kids that were exposed in the classroom were. And I think it just, because right now we can't know anything. They don't, and the only way we're going to find out if somebody is positive is if the family tells us. And there have been situations where, you know, people don't, I think this is something people don't necessarily want to say that they have or why they're home, not saying in the school. So I think, you know, Sarah Brooks is our COVID point person for the whole district. So it would be really helpful. I'm already an agent of the board, but it would be really helpful if the rest of them were for the district.
Exactly.
I don't know if I have to recuse myself from this vote, probably.
I don't believe so, because we're not making a decision that will directly benefit you in a monetary capacity.
Okay.
I would make a motion to approve making school nurse agents to the Board of Health for COVID-19 case investigations.
I'll second that.
Okay, all in favor by roll call vote? Jim Cooper,
Yes.
Melissa Murphy,
Aye.
Meredith Lepre,
Yes.
and Steve Visco says yes. So that's done. Good. Do you want to jump in on the mask order now or before? Were we going to talk about the, Melissa, did you?
Oh, well, thank you, Steve. I just wanted to, and maybe this is what you're referring to, but I just had a couple of questions under board member updates and concerns I wanted to bring to the board, if that's okay.
Yeah.
So one is, and I have forwarded this message on to Roberto, but I think it's an important reminder. We've gotten some feedback from people who have continued concerns about mask orders being followed on the ferries, particularly the fast ferries. And I think it's a really good reminder that we don't always know why somebody may not be wearing a mask. But if you see people who are unmasked on those vessels, to report them to the bursar or to staff so that they can help and address it. If I'm saying anything incorrectly, Roberto, please interrupt me. And that both Libby and Roberto have reached out to both the Highline and the Steamship Authority to just again ask for their continued cooperation I happened to take the slow boat this weekend, and the steamship made no less than 3 or 4 messages throughout the voyage about the wearing masks and staying safe and eating and drinking outside or in your car. So I think they've been great partners to our community, and I encourage people that if they see unsafe behavior to report it at the time they see it on the boat. Am I capturing that correctly, Roberto?
Yes, you are.
And the other thing I just wanted to perhaps suggest or get some feedback from Roberto on is with our emergency orders about the mask and the limitation on gatherings. When would we want to remove that emergency order? Or are we waiting for green? Are we waiting to go back to yellow? And would it be prudent for us to schedule a meeting for 2 weeks from now if we're trending positively, so that we don't have to schedule an emergency meeting to release that order? So those are my thoughts. Thank you.
Absolutely. So one of the issues with the order number 13 is that we should be going into yellow today in about 30 minutes when the report gets released. But we are just barely in the yellow. One more case on average than what we had in the previous 2 weeks will push us back into the red. So what I would like to see before we lift this completely is 2 weeks in the green. Or maybe even just 2 weeks in the yellow and 1 week in the green. Something that will show us that we are consistently at a lower caseload. I think that honestly, doing it on a monthly basis is probably not a bad idea. As of right now, the November meeting is scheduled to be on, let me pull up my calendar, the 19th, which is 4 weeks from today. So I think that's relatively safe, because if we did yellow, yellow, green, that 4th week is when we'd be meeting anyway. So I think we're still in good shape. If I do see us trending negatively, we can just keep it in place.
I would say I would agree with you too. And after watching your presentation last night and seeing all the other communities that all of a sudden just popped up in red, we're a little ahead of what's going on. And the mask, it works. It works. So we're getting our numbers down.
Actually, now when you mentioned the masks, in an email response today, I brought up the filtration rates and things like that about the size of the particles. And it's also important to understand that, and I'll read it out actually. If a person is worried about the groups of people who aren't wearing masks, that a person purchasing something like a P100, which is the 100 particulate mask, creates a vacuum seal on the face. It's actually this mask. It comes with the pink cartridges that people see. This one's made by 3M. And if you'll see, it has this rubber seal here. So you'll look like Bane, but it does work. That actually filters 99.97% of all particulates down to 0.3 microns. For reference, a single SARS-CoV-2 or COVID-19 molecule is 0.3 microns. So that is huge. And when a person sneezes or coughs, the airborne droplets that pop out are actually around 4 microns in diameter. So more than 10 times what the size of what this can actually filter out. And what a typical N95. And N95 filters out 95% of all particulates 0.3 microns and above. So when you're really worried about what it is you're filtering out, the masks are incredibly effective at blocking that, especially droplets, because the virus is so heavy in relative matters. it's not as airborne as measles, which is an incredibly light virus that can just blow around in the wind. So that stays airborne for 2 hours. The COVID virus, SARS-2, is so heavy it actually drops out of the air. It can be brought up if it's an aerosolized form that's not droplet suspension, which is water. So it can actually float around in the air. But that's incredibly rare, and that's the fears that you see when you're doing hospital work. If somebody is treating somebody with COVID, and they're coughing things up into the air, or they're doing a procedure, like a suction, that sometimes that aerosolizes the virus. That's where you would be seeing that. But if a person sneezes on the boat, those droplets are easily 4 microns or higher. And as for reference, a 4-micron filter is actually a coffee filter. A simple paper coffee filter can filter out airborne droplets. So it's really important to understand how effective those masks actually are. So thank you for bringing that up. We do understand that's important, and you get a lot of complaints of people that say, this doesn't protect people, things like that. Well, this double layered Tyvek cotton does. There's a really good video out there that Bill Nye made, where he explains if you're wearing your mask and you can blow a candle out, the mask isn't filtering anything. These actually stop enough airflow. If the most important aspect of the aerosolized thing is to just stop that projection of virus. So if you do this coupled with the 6 foot of distancing, the risk is incredibly low. So we know masks work. Thank you. Sorry,
No, that was good. Does anybody have any other concerns, or are there any other updates that we haven't been apprised of? Or
Art.
Go ahead, Art.
So we forgot to put the innovative alternative policy for sort of on this agenda, because when you voted on it, it was clear to you what you did, but it wasn't explained out, so that in 5, 6, 7 years, when faces change, we know what we actually did. So we probably need to get that on the next agenda, so that the verbiage is right in the record as to how you develop this IA policy, why it came about, and the motion is clear, so that like I say, these people can receive the 15 years from install or from permitting going forward. But with new board members, I'm not sure, hopefully they have a better understanding, but the whole policy, the whole gist of it was, if you installed an innovative alternative system, and then sewer came along under Regulation 69, you were going to be forced to connect to sewer, regardless of putting in a $60,000 septic system 3 years ago. So the board in September of 2016 developed a policy saying you can use that system for 10 years from the date of permit or certificate of compliance forward. And if sewer came in front of you, you wouldn't be required to connect until your 10 years is up, sort of, so you're not whacking people twice, because these things are very expensive. And the innovative alternatives, certainly in some cases, people are putting them in to be environmentally sensitive. Others, it's an incentive to get that bedroom credit, like you heard earlier on 22 Boulevard. So that's the back history on it. And going forward, obviously from September, I think 17th, 2020, everybody's going to get 15 years who already installed one, if sewer comes to their neighborhood. And then anybody who permits after that date is going to get 15 years from the certificate of compliance of install till they would have to connect to sewer. I don't know, hopefully that makes sense to everybody.
Yeah.
But I just wanted to get it in the record so that we know where we were, where it came from, and what we're amending. So the policy from September 15, 2015 has been amended to what I just said.
We can put that on the agenda for next meeting, get the verbiage right and just get it on the record so it's more clear. It was a little confusing when we voted on that the last month.
So, Anne, I know you're watching because I can see you. Can you go ahead and put that on the November agenda? Thank you.
And was there anything else? Anybody have any more concerns or any other updates? Melissa?
Not that our attendance is high and riveting, but Roberto, could you just quickly update us on the stop the spread at the hospital? I think that's so great that they're here, and I think that's new since our last meeting. And also, I think it's worth noting that flu shots are still in abundance through NCH, and we encourage all of our community members to get the flu shot.
Yes. So actually yesterday was the first day that the Stop the Spread hit its 75 person quota. So that's good. So the information is out there. So Stop the Spread is a state-funded program to allow asymptomatic COVID-19 testing for everyone for free. And we're no longer doing that deep brain tickling swab. It's actually the anterior nasal swab. So it only comes up to the front area of the nose. So it's a lot more gentle, and it's a lot easier for children to do. So it's not as traumatic anymore. So what that does is it pays for 75 tests a day. And what we're doing is they're doing it right at the portico at the hospital and on your normal everyday thing. So that we will have that for a minimum of 3 weeks after we get out of red. But we have issued a request. We have sent a request to the state to allow us to keep that in perpetuity so that we don't have to go back to having to pay for testing. So we're waiting to hear back on that. Because as Gary said to the governor's office, actually, to ex-Secretary Sutters, every other county in the state of Massachusetts has a Stop the Spread site except for the 2 islands. So it's pretty discriminatory to not allow to have one here. So we're trying to get that updated. Otherwise, I think we're in good shape. And last I heard about a week ago, they have given over 2,700 flu shots. That number was expected to break the 3,000 this week. So we've got a significant amount of flu vaccines already given out. But don't forget, it is actually a requirement for schools this year, start from the state. So please get your flu vaccine as soon as possible. It is available for free at the hospital. So, and it's all done at the drive-through. So it's pretty quick. I had mine done 2 weeks ago, and it's relatively painless.
Thanks. Go ahead, Jim.
Roberto, anything, the island home is still locked down?
Yeah, so unfortunately we do, to be safe, we do have to restrict the groups of people coming in and out of OIH. We are really lucky to have had 0 cases within staff and residents at OIH. But unfortunately, we can't allow a lot of visitors out there. So it's still pretty locked down.
Okay, does anybody else have anything? No?
I'll make a motion to adjourn.
Second.
Okay. All in favor by roll call vote. Melissa Murphy,
Aye.
Jim Cooper,
Yes.
Meredith Lepre,
Yes.
and Steve Disco says yes. Okay, thanks for coming. And maybe you could, how do we find out if we get out of the red? Is there some way?
The report will be released in about 15 minutes at 4 p.m. So 19 minutes,
And it'll be on our site?
and I'll get that posted.
Okay, great. Okay, thanks, everybody.
Thank you.
Bye.
Thank you. Here, thank you, Mark. Take care.